Hello and welcome to NeuroHope. I'm Dr. Hasibullah Hanif, and here we make a complex medical concept simple and clear. So today we're starting a new series of CNS pharmacology series, and in this first episode we will be exploring the basic antipsychotic medication. So if you come here, we have D2 receptor, and D2 receptor you can find in many areas in the CNS. You can find them in vomiting center in medulla oblongata, and you can find them in basal ganglia and striatum, and also it's calling nigrostriatal pathway, and you can find them here, and you can find them in pituitary gland, and you can find them in mesocortical and mesolimbic systems. So this D2 receptor you can find in many areas, and we don't have any selective medications that we can block only in vomiting center, or we can block in nigrostriatal pathway, or we can block in pituitary gland. So if you give a medication for vomiting center, which is called CRTZ, also represent for chemoreceptor trigger zone, so it's affecting on all those areas. So coming here, you see this the dopamine in the CNS we have in CRTZ, chemoreceptor trigger zone, and we have in limbic systems. So this is a limbic systems here in mesolimbic and mesocortical area. If the dopamine is increased in CRTZ or vomiting center, it causing vomiting, and if dopamine is increased in limbic system, it causing schizophrenia like symptoms. It's not schizophrenia, it's called schizophrenia. So when the dopamine is decreased in basal ganglia or pituitary gland, in basal ganglia, when it's decreased, causing Parkinsonism here. When it's basal ganglia or nigrostriatal pathway, when it's decreased the dopamine, it's causing Parkinson's. But when it's decreased in pituitary gland, it's opposite of hyperprolactinemia. When the dopamine in pituitary gland is decreased, they're causing hyperprolactinemia. And when the dopamine in pituitary gland is increased, it's causing hypoprolactinemia. It's opposite of each other. So coming here in chemoreceptor trigger zone is causing vomiting. So that's why we should give him dopamine antagonist, not agonist, antagonist. We trying to reduce the dopamine here. So we can give him metoclopramide, we can give him domperidone. This is the best medication, domperidone, because it doesn't affect that much about mesolimbic systems or in basal ganglia or in pituitary gland, because it's not crossing brain blood barrier. So you know the vomiting center is outside of the brain blood barrier. So treating vomiting by block D2 receptor in chemoreceptor trigger zone, but may cause Parkinsonism and hyperprolactinemia. You know, when you're treating this two and they're causing this one, when you're treating this two, they're causing this one. It's opposite of each other. Coming to schizophrenia, it's located in the limbic systems. Even dopamine is increased, causing antipsychotic symptoms like hallucinations, delusion, and disturbed of thinking. So treating schizophrenia by block D2 receptor in the limbic system, you have to block the D2 receptor here in the limbic systems. So also when you treat schizophrenia, they may cause vomiting, and they cause vomiting. So here in basal ganglia and Parkinson's, we try to reduce the we try to increase the dopamine. Here we should give dopamine agonist to increase the dopamine level. Here dopamine is decreased, we try to increase the dopamine. For example, we gave him L-dopa or bromocriptine, treat Parkinson's activating by D2 receptor in basal ganglia, may cause vomiting and hallucination. When you're treating this one, Parkinson's, they're causing vomiting and hallucinations, schizophrenic-like symptoms. Why? Because it's increasing the dopamine. And you know, when dopamine is increasing, it's causing schizophrenia and vomiting. And in pituitary gland, same thing. When the pituitary gland, dopamine is decreased in pituitary gland, it's causing hyperprolactinemia. And we treat it by bromocriptine, and treating hyperprolactinemia by activating D2 receptor in pituitary gland. It may cause vomiting and hallucination. Same. It's causing vomiting and hallucinations when we treating when the dopamine is decreased in pituitary gland. So thank you so much, and If you find this video helpful, don't forget to subscribe and NeuroHope and share this video with your friends, and let's make learning medicine easier and together. Thank you so much.